Like you've correctly stated, South Africa has officially joined the fight against the coronavirus with the first confirmed case in KZN. So let's just take a look at how it got here. We know, of course, that a 30-year-old KZN man who landed at the King Shaka International Airport around the 1st of March is that particular case. He was holidaying with a group of around 10 people in Italy and landed at the King Shaka International Airport around the 3rd of March. He then made his way to see a GP. Tests were then officially done, and that first case was then confirmed by the health minister, who of course found out at the same time as the patient. Now let's just take a look at the global numbers, what we're looking at around the world. Globally, we are looking at around over 100,000 confirmed cases, but at the epicenter, in fact, of where it all began, we are looking at around 80,651 infections, and we're looking at over 3,000 confirmed deaths in China at the epicenter of the coronavirus. Now let's look at that global picture as well. Across the world, we're looking at 97 countries now affected by the coronavirus, and of course these numbers change almost daily. We're also looking at over 100,000 confirmed cases, and globally looking at around 3,497 deaths. Now let's look at our continent here in Africa, and of course in particular Algeria is also now being called the epicenter of the virus here on the continent at around 17 deaths, 17 cases rather. Egypt is now also following close behind with around 15 cases, and that is actually where one of the first confirmed cases of the virus was spotted. We've got Senegal coming at 4 cases, Morocco with 2, Nigeria with 1, South Africa as well with 1, and the latest being Tunisia as well as Togo, also coming in with 1 case each. However, no confirmed deaths at this stage. Now, looking at the case here in South Africa, how it actually came to South Africa was the fact that we had that particular man traveling to Italy. They're looking at around 4,636 cases, and their death toll is now sitting at 197. Now, there's a lot of questions being asked around, the similarities and differences between the coronavirus as well as the influenza, which is the case of the flu. And we all know, of course, we are fast approaching the flu season, and we have heard from the NICD that, of course, people should be looking into taking their flu shots, just so that they can prevent, all the misconceptions around how the virus is passed on. So firstly, Covid-19 and influenza are similar in the way they present in their symptoms. So your cough symptoms, feeling lightheaded, etc. However, there is a particular difference in how they manifest or how quickly they're manifesting. So as a result, the same public health measures such as using, safe hygiene measures, wash your hands. We are seeing stockouts of hand sanitizer as well as, preventative measures such as that. But both the diseases are transmitted by contact, such as droplets as well as fomites. Also, in terms of the differences between the Covid-19 as well as influenza, it's that speed of transmission, of course. So in terms of the influenza, it has a shorter medium of incubation, so it is quicker to pick up, unlike the Covid-19. But of course, this also means that the influenza can also spread faster than the Covid-19. So what medical interventions are we looking at in terms of preventing the virus from spreading? We are, of course, asking that people, just not to keep close contact with others or try to, handshake. We are seeing the Wuhan shake as well. So in terms of the vaccines, we don't have a cure as yet for the Covid-19, but to prevent the spread, we are asking people, of course, to ensure that they are keeping high hygiene measures. But in terms of getting more information around Covid-19, we are appealing to South Africans across the country to call in to the helpline number, that is 0800 029 999. If I can repeat that number for you, 0800 029 999. So those are the latest numbers, Anili.